Hi, everyone. Welcome back to Learn With Me. I'm Deborah Hanson, and today we're going to be looking at AP Psychology 5.4, Selection of Categories of Psychological Disorders. So this section of Unit 5 has 10 CED questions. Yes, I said that, 10 CED questions. I think that's the most I've ever seen on a section in AP. But anyway, so we're going to go through all 10 of those questions in 10 separate videos, as well as there are a lot of key terms that go with this particular section. So again, we'll talk about those in a minute. But before we get started, thank you so much to everybody who's hit that like and subscribe button and left me comments and sent me emails, and it's been absolutely wonderful. Thank you so much for doing that. Okay, let's get started. So as I was saying, there are 10 CD questions, which with that comes with a lot of key terms, obviously. So there are 2 full slides here of key terms that you'll need to know. Those are on a separate video with definitions and examples so that you can learn all the key terms for exam day. As I always say, the key to the 5 is really learning the key terms and being able to apply them. So the first CD question we're going to look at for 5.4 is describe the symptoms and possible causes of selected neurodevelopmental disorders. So we're going to break that all down with all the essential knowledge you need to know to help you on test day. So let's start off with the definition of neurodevelopmental disorders. So neurodevelopmental disorders are a group of conditions with onset during the developmental period, often affecting behavior, cognition, and social skills. So key focus areas are behaviors appropriate for age or maturity range, symptoms present early in life and can persist into adulthood. And we're going to look at 2 selected disorders. We're going to look at attention deficit hyperactivity disorder, which is ADHD, and autism spectrum disorder, which is ASD. So let's break those down. We're going to start off by talking about attention deficit hyperactivity disorder, so ADHD. It's a condition that affects focus, impulse control, and movement. ADHD symptoms generally fall into 3 main categories: inattention, hyperactivity, and impulsivity. So let's look at each one of those. First, start with inattention. This is difficulty focusing, following instructions, or staying organized. For example, a student may forget homework assignments or frequently lose their belongings. The next one is hyperactivity. This is excessive movements, fidgeting, or talking. An example is someone with ADHD may struggle to sit in class and constantly feel the need to be moving. The last one is impulsivity. Acting without thinking, interrupting others, or having trouble waiting. So for example, a person may interrupt conversations or answer questions before they've even been finished asking them. So not everyone with ADHD experiences all these symptoms, and they can vary in intensity. But these core behaviors make it harder for individuals to focus and regulate their actions. So what causes ADHD? Researchers believe it's a combination of genetic, physiological, and environmental factors. So we talk about genetic causes. ADHD often runs in families, meaning if a parent has it, their child is most likely going to have it also. The physiological causes are brain scans show differences in areas responsible for impulse control and attention, particularly in dopamine regulation. And lastly, environmental causes. So for example, exposure to toxins like lead during early childhood may contribute to development of ADHD. So let's look at an example. If a child has a family history of ADHD, those are genetics. They struggles with dopamine regulation, physiological, and was exposed to a certain environmental risks, they might be more likely to develop ADHD. ADHD is a neurological condition that affects focus, activity levels, and impulse control. While it can present challenges, many people with ADHD develop unique strengths like creativity and problem-solving skills. So understanding ADHD helps reduce stigma and improves the support for those who have it. Now let's talk about Autism Spectrum Disorder, ASD. It's a neurodevelopmental condition that affects communication, behavior, and sensory processing. Autism spectrum disorder is called a spectrum because symptoms vary widely from person to person. However, there are 3 main areas where people with ASD experience challenges. Okay, let's explore those. One is social communication deficits, difficulty understanding social cues, maintaining eye contact, or engaging in back and forth conversation. For example, a person with ASD may prefer direct and literal communication and struggle with interpreting tone or sarcasm. The next one is restricted and repetitive behaviors. So engaging in fixed interests, repetitive movements, or strong preferences for routines. For example, someone might flap their hands, repeat phrases, or become distressed if their daily routine somehow changes. And the last one is sensory sensitivities. Some individuals may be over or under reactive to sensory input like loud noises, bright lights, or certain textures. For example, a child with ASD might cover their ears in a noisy environment or dislike the feeling of certain fabrics. These characteristics can appear differently in each person with ASD, which is why it is considered a spectrum disorder. So while the exact cause of autism spectrum disorder is still being researched, scientists believe it results from a combination of genetic, physiological, and environmental factors. Here's what we know. The genetic causes. Some cases of ASD are linked to genetic mutations or inherited traits that affect brain development. Physiological causes, well, we see brain scans reveal differences in neural connectivity and early brain development in people with ASD. And lastly, environmental factors. While not a direct cause, factors like parental age, prenatal exposure to toxins, or infections may contribute to ASD risk. So, for example, a person with ASD might have a genetic predisposition that affects brain connectivity, physiological, and may also have been exposed to certain environmental factors before birth, which would contribute to their development of ASD. Autism spectrum disorder often affects social communication, behavior, and sensory experiences in very unique ways. With greater understanding and support, individuals with ASD can thrive in their own way and contribute to their unique strengths in the world. So here I just made you guys a slide that you can see the differences between ADHD and ASD. So the core issue, the social interaction, the focus, and the causes, just to help you do like a little compare and contrast. Now let's look at all the possible causes of neurodevelopmental disorders, conditions that affect brain development, learning, and behavior. Let's explore the different factors that contribute to these disorders. One possible cause of neurodevelopmental disorders is environmental factors. There are external influences that can affect brain development, especially during pregnancy or early childhood. So, for example, exposure to toxins, substances like lead, mercury, or air pollutants can interfere with brain development, increasing the risk of conditions like ADHD or learning disabilities. Maternal substance use or infections. When a mother consumes alcohol, smokes, or uses drugs during her pregnancy, or she has an infection, for example, like rubella, it can impact fetal brain development. So, for example, lead exposure in young children has been linked to cognitive impairments and attention issues, making it an important environmental risk factor. And another important category is the physiological factors, which involve differences in brain function and chemical regulation. So, for example, differences in brain structures and connectivity. Some individuals with neurodevelopmental disorders have structural differences in certain brain regions responsible for memory, attention, or impulse control. Neurotransmitter imbalances, like disorders like ADHD, involve differences in dopamine regulation, which can impact focus and motivation. So, for example, brain scans show that individuals with ADHD often have lower dopamine activity, which affects their ability to maintain attention and regulate impulses. And lastly, genetics plays a major role in the development of neurodevelopmental disorders. Some conditions tend to run in families due to the inherited traits or genetic mutations. So, for example, family history. If a close family member has a neurodevelopmental disorder, there's an increased likelihood that others in the family may have it too. Next one is genetic mutations and predispositions. Some disorders are linked to a specific gene mutation that can impact brain development. So, for example, research suggests that autism spectrum disorder has strong genetic component, with certain gene variations increasing the likelihood of developing the disorder. So, neurodevelopmental disorders arise from complex interactions of environmental, physiological, and genetic factors, and understanding these causes can help researchers develop better interventions and treatments. So here's a few exam tips and key points to remember, okay? Understand the symptoms and differences between ADHD and ASD. Be able to explain potential causes and how they interact, for example, genetic, physiological, and environmental. Use examples to illustrate symptoms and real-life implications. So that was the essential knowledge for CED question number 1 for 5.4. And the question was, describe the symptoms and possible causes of selected neurodevelopmental disorders. Hopefully you found that helpful. If you did, hit that like and subscribe button for me. Leave me some comments too to give me some feedback if you have any ideas for future videos, anything. I'm really always happy to hear from all of you. Thank you so much for listening. See you next time.